Hi, I'm Dr. Leana Wen, public health professor at George Washington University, and I'm glad to be moderating today's conversation on governors' approach to economic and public health recovery after crisis. We know that governors have been in the key position to lead their states through the pandemic with crucial decisions around closures, reopening, testing, and vaccination, and so much more. And I'm really delighted to be discussing all of this today with Governor Ned Lamont, who has served as Connecticut's governor since 2019. He is also the co chair of the National Governors Association's Pandemic and Disaster Response Task Force. Welcome, Governor.
Hey, Dr. Wen, nice to see you. Good morning, everybody.
Well, I wonder, Governor, if I can open by asking you about just in general about how your state has gone through the pandemic, because it's been a very long 22 months for us all.
It's been particularly long for New York, New Jersey, and Connecticut. We were hit really hard very early, back before anybody knew anything. So I had to work very closely with the governors of New York and New Jersey as we tried to come up with a response. You may remember back then that CDC could maybe do 10 tests a day, and they had to send them down to Atlanta. You didn't get a result for maybe a week. So we were flying blind at that point. And we had to work together, to give people out there who are terrified. I mean, we got the 211 calls, just, am I gonna live? What's tomorrow gonna look like? Give them a sense of confidence that we're working through this together. And then rally our healthcare community, our amazing hospitals and Yale, New Haven, and Jackson Labs and UConn to help us take the lead as we explain to people what we had to do to keep them safe.
Yeah, no doubt. And I wonder if you can bring us now to present day and the last several months. How has Connecticut done with the Delta surge? And what do you predict lies ahead this winter? Do you think that we could see another surge in your state? And how are you preparing for that?
Well, we are in a totally different place than we were 18 months ago when we were the hardest hit and had the highest infections. Obviously, there were no vaccines back then. There was no testing back then. There were no masks back then. Today, I can tell you we're in a very different place. We have the highest vaccination rate and the lowest infection rate in the country. Massachusetts is right next to us. We're the Walmart of PPE in that sense, Dr. Wen. We're better prepared for what could come forward. Our schools and our businesses are open. People are getting a little wobbly now. They feel like there have been some restrictions for a long time, especially when it comes to our schools and wearing masks. But our schools are open. Our kids are in class. That means they're getting educated and their parents are able to go to work.
I so appreciate your mentioning about the importance of in-person school. We know that there are other places in the country, for example, that have not allowed even school districts to be implementing mask requirements and don't have the kinds of protocols that you do in Connecticut. What would you say to those parents who are in areas like that in the country where maybe their kids are not as well protected as yours are in Connecticut?
I think they're nuts. I mean, they've said, Florida, they say you're not allowed to, a school is not allowed to ask their kids to wear masks. A business is not allowed to ask a consumer or an employee to wear a mask, not to mention, get vaccinated. And what that meant is, Florida and, Georgia and Mississippi and Alabama, they were hit very hard in these second or third waves. This short school year, they had probably 1 million school days that were lost, at least for 1 million students lost at least a school day due to quarantine. We haven't had that in this state. I've left it up to businesses, whether what they want to do in terms of a mask. And now President Biden has said, I want every company with more than 100 employees to get vaccinated. Those rules are coming out soon. So I think we're erring on the side of caution. That said, I think we're going to have a pretty good spring. I think our kids are going to have the opportunity to be vaccinated by then. I'd like to think we powered through the flu season and people are really looking forward to the sun coming out again.
No doubt about that. For this winter, though, would you anticipate that there are any circumstances that you could have a return to more restrictions like mask wearing?
I don't think so. Because we've got about 90%, almost 90% of our adults are vaccinated. We've got probably 75% of our 12 to 18-year-olds vaccinated. So I was scared as could be of Deltas. We were opening up the schools. I saw what was going on in other parts of the country. But so far, the Northeast, we have a pretty good backstop in terms of vaccinations. That said, let's face it, Delta is so highly contagious that they can find that 10% of people who aren't vaccinated for one reason or another, and bad things can happen. But so far, so good. I don't think we're going to have to turn the clock back.
Yeah, and a while ago you were talking about testing and how we didn't have sufficient testing at the very beginning. How is Connecticut doing when it comes to widely accessible testing? And is there more that you think the Biden administration can be doing in this regard?
Yeah, we've done very aggressive testing. We're doing testing in our schools. It's not as important as it was before in this sense. I mean, I said, look, I want all state employees to get vaccinated. If you don't get vaccinated, you got to test once a week. But remember, Delta is so darn infectious. You can test negative on Monday and you can be infecting people on Thursday. So it doesn't have quite the same meaning as it did with some of the previous variants you had out there. But that said, it still gives us a really good handle in terms of what we see going on, if there's any community spread, which there is not right now.
Yeah, I mean, I think a lot of people, myself included, have also been arguing for having more rapid testing, the way that, for example, other countries have, so that before people are getting together for events, in real time you get tested and have that result to guide whether you're able to gather safely over the holidays and other things. Is that something the state is also making a part of your approach when it comes to certain settings?
We're waiting for the technology to change. I'd like to have that same day rapid testing, make that readily available at the retail level like you see in Europe. You can do that on a daily or every other day basis, keep you safe, know that you can go to school or work safe. I think that's incredibly important, but not as important as getting all of us vaccinated. I've got probably 98% of my state employees are either vaccinated or testing right now. I've got virtually all of my teachers are vaccinated. We're working through the business community as we speak. You couldn't go to the Foo Fighters concert last week unless you could show you were vaccinated. So I think that is probably what our answer is going to be.
Well, that brings me to the question about vaccine requirements. Can you guide us through how you've approached thinking about vaccine requirements? Which groups did you begin with? Just guide us through the process of the conversations that you had with stakeholders and others about implementing these.
Well, it's the world turned upside down. Back last December, January, when they were just introducing the Pfizer, then the Moderna vaccine, and we were looking at how are you going to prioritize who gets the vaccines, and all the worried well were, all lined up, ready to go, and the CDC was no help at all. I mean, they said, I think older people, I think everybody who has a vulnerability or pre-existing condition. Then they listed those that smoked in high school or were a little bit overweight. Then they said essential workers, anybody who's forward facing. And you do the math, they limited it down to about 110% of the Connecticut population. So that was zero help. We had to prioritize to keep it rational. We found that the close correlation between fatalities, hospitalization, and age was clear. So we started at 75 and above, then 65 and above, 55, et cetera. There was no cheating. People understood exactly what we were doing, why we were doing it. And like I said, we've got to a very high vaccination rate across all segments of our population who are eligible. And it was only very recently we started moving towards mandates, a little bit following the lead from Washington, D.C., starting with healthcare workers, starting with nurses in nursing homes who are taking care of folks who are elderly and vulnerable and at risk. And it started out being a little sketchy, and I'm not going to do it. You can't make me. But as I said before, I think, well over 90% of our people are, vaccinated and a few are testing.
Yeah, I mean, can you talk though about any pushback that you may have received in encouraging vaccinations and also how you have addressed that?
Yeah, I mean, a year and a half ago, here I'm in the state capitol in my governor's office. People would be driving around the building, honking their horns, saying, "Where's my mask?" Now they're driving around in the other direction, saying, "You can't make me wear a mask." Back in January, February, people are really riled up. How come I'm an essential worker and you're not making the vaccine available for me right now? And now the world is turned on its head. You can't make me get vaccinated. That said, the overwhelming majority are vaccinated, fewer testing. So I think we're in pretty good shape.
And what about dealing with unions? I know that a number of other states have reported some issues with, you were mentioning teachers earlier. Has that been an issue for you? And what kinds of strategies or tactics may be helpful for others to be considering as they're also thinking about how to talk about vaccine requirements?
Well, the first issue we had with teachers in schools in general was, back a year ago when the CDC said you need 6 feet of distancing between desks. Well, where'd you come up with that number, 6 feet of distancing? That means if your average fifth grade classroom, only half the kids can go into school. And that gave a lot of teachers a lot of hesitancy about going back in. Now with the vaccines, I'd say 99% of our teachers, 99% of our kids are back in school. That makes a big difference. I really wanted to make sure our schools were open. They were open last fall, they're open this fall, and they're open safely.
Fair enough. And you also mentioned working with businesses. I would imagine, and certainly I have heard from businesses that actually are glad to have the support of state and federal officials in implementing vaccine requirements because maybe it's something they want to do, but they want the cover, if you will, from government officials. I wonder if you've seen something similar, and how have you been working with them to incentivize vaccination?
Well, first of all, we started with incentivizing rather than mandates. You can imagine that was a lot easier to digest. Drinks on us, you got a free drink. Don't be the sap stuck with the bill, get vaccinated. We got concert tickets in front row. We did everything we could, especially to get young people vaccinated. I think, now you're right. I think the businesses are glad that people are forcing their hand so they don't have to play the heavy. It can be Joe Biden or Ned Lamont playing the heavy. They made me do it. But I think you're going to find some complications. I think a lot of businesses are getting some pushback from a number of their employees. So we'll see how that works. We were able to work it out with our unions. We were able to work it out with our state employees. Now we'll see how Electric Boat and Pratt & Whitney and Sikorsky and some of our bigger employers can work it out as well.
Hmm. No, I appreciate that. Now, earlier you were talking about the collaborations with your neighboring governors in New York and New Jersey. I'm sure a lot of people listening are wondering about the benefits and any drawbacks of this type of coordinated approach.
It was absolutely invaluable. COVID doesn't know any borders. So what good's it do me to say I've got to shut down my bars if then Andrew Cuomo said, I'm keeping my open. Then everybody would just be driving back and forth and you'd be stirring up the COVID pot. We had a really strong relationship with Charlie Baker in Massachusetts. He and I talked every week. What do you think next now? And we did a lot with Massachusetts on a coordinated basis. That meant nobody had incentive to drive back and forth between states in order to get their beer. Although they came to Connecticut to play golf, he closed his down. But more importantly, we could speak with one voice. And I think that was very helpful because sometimes we were getting contradictory information coming out of the White House back then.
Yeah, fair enough, and I definitely appreciate what you're saying about the virus knowing no borders, and I think we have found out in other states too that it doesn't really make sense. You cross over the line, and its masks are off, and it doesn't seem like there's a pandemic. Versus on the other side, there are different rules. What about some other lessons that you've learned in this process? I'm sure people would want to know if you could do it over again. What are things that we should be taking away from what's occurred thus far in COVID-19?
I would have done everything earlier. I would have done everything earlier in terms of masks and schools and bars. Fortunately, we were doing things then in coordination with New York, and we were sort of 3 weeks behind New York. So that did mean that when we were had to close things down, we were closing them down earlier in the cycle. That helped. I'd say, Dr. Wen, broadly speaking, this is a health conference. I used to think of health as a individual right, a human right, and we've got to make this readily accessible to everybody. It's the right thing for you and your family. I can tell you now, as a governor, I think of it in terms of public health and community health. And it doesn't do us any good if I've been tested, but that homeless person out there doesn't have access to test, doesn't have access to a vaccine, and is walking around the streets. It really reinforces in my mind what it means to be in this together. And I think I'd like to think that's one of the beneficial lessons of COVID, as we see the strength of working together, how we look out for each other, our fellow human beings. We're all better off.
I think that's a great way of framing it. And I think another lesson from COVID may also be about the health equity issues that have been brought to the forefront. How have you addressed the issues of health disparities that COVID-19 did not create, but certainly has unmasked and unveiled?
Our Black and brown populations much more likely to get infected, much more, living in multi-generational homes, much more likely to suffer complications, often a lot of pre-existing conditions there that made it tough, and much more likely to die. And the inverse of that is a little more reluctant to get tested, and more importantly, a little more reluctant, given some past history, Tuskegee experiment and such, to get vaccinated. So we had to really work hard to make sure that nobody was left behind. It starts not with me, but with trusted advocates from the community. I'll tell you, the African-American churches were just amazing. And they'd finish off a sermon and go, I can't tell you what to do, but I talk to God, and God tells me to get vaccinated. It's probably a good idea for you. They'd come out into the driveway. We had the mobile vaccination van there, and a lot of people got vaccinated. So we worked really hard to make sure nobody was left behind.
No, that's I think that's really important. The idea of reaching people where they are, understanding that access is a major problem. A key element of public health, as you know very well, is public trust. How have you been able to balance making the best science-based, evidence-based decisions while also responding to the desires of your constituents, which sometimes may conflict with that best science?
I had to bring people along. I couldn't do it by fiat. I'm not Wuhan. I can't shut things down. I couldn't mandate everything, especially those days, and threaten you with a fine. I had to say, here I am with Dr. Gottlieb. Here I am with Zeke Emanuel. Here I am with Deirdre Gifford, the head of our public health. This is why I'm recommending this. This is why it's in your best interest for your family and your community. I hope you follow along. So we were much more likely to wear a mask early on than most other states. I will tell you, we were hit hard early on too. So people had learned the hard way. Much more likely to get tested, not by fiat, but just by sort of general persuasion. You can't get too far ahead of people, but you got to continue to lead and explain what you're doing and why you're doing it.
And what about this rampant disinformation that's out there? I mean, a lot of people have said, and I agree with this, that we're not only facing a pandemic of the virus, but facing a pandemic of misinformation and disinformation. What strategies have you found to be effective at addressing this on a local and state level?
Well, and then we had a president that said ingest Lysol. So we were getting a lot of shaky information. We had to take Lysol off the shelves. People follow that lead. Now, as more seriously, it's the internet and Facebook and a lot of that misinformation. All I can do is come out with the best information I can. All I can do is say these are the best healthcare professionals. They're your neighbors. I'll tell you another great advocate for us, a trusted advisor, a trusted advocate, were the football coaches. I got them to go to all the high schools and they talked to their teams and they said, look, these are sort of white 17-year-old football players, some a little reluctant to get vaccinated. And they said, look, I want you to be part of the team. You're not part of the team if you're in quarantine. I need everybody on the field. That's what it means to be a team. And we got all of our football players vaccinated. That made a big difference and set an example around the rest of the high school.
Yeah, and indeed, you're making a point that many of us in public health know well, which is that it's not just the message, but it's also the messenger. And so it was a brilliant strategy to be able to enlist those who are trusted messengers. What about the funding? Can you talk more about how you've approached using the CARES funding from Congress to help to rebuild the public health infrastructure so that we are better prepared for the next time?
What we've done is prenatal and postnatal care for all of our citizens, including those that don't have all the necessary documentation, give everybody a start. The big expansion of daycare and childcare in the history of the state, what it means for those kids to get back in the game, those little kids, and allows their parents to get back to work. And a big expansion of public health starting in our schools, not just nurses, but social workers. I got to tell you, people talk about long COVID in a physical sense, but our kids were hit hard. And that year, we call it quarantine, for them was isolation. And I thought getting back to school, that's just what you need. You're there with your friends, you're able to relax, but it's also energized a lot of the demons and a lot of the stress. So everything I heard from my teachers and superintendents, I thought, all right, learning loss, maybe it's reading, maybe it's math, I'll get you some more teachers. They said social workers, they said guidance counselors, they said nurses, give me more folks who can help my kids through. And I think when it comes to public health and nurses, that's going to be permanent.
I'm so happy to hear you say that as someone who used to oversee school health in my city in Baltimore. And so many of our children and much of the public health infrastructure was already neglected, and there was already not enough attention to our vulnerable communities. And so seeing this as an opportunity to rebuild that public health infrastructure is so crucial. And I'm so glad that you're starting with our children in this regard. Anything else that you would like to impart to our audience, as there are policymakers and business leaders and so many others and practitioners who are going to go through the next phase of this pandemic? Any other words of wisdom that you would like to leave us in terms of lessons learned and how we might want to engage going forward?
I think there's a extra new appreciation for our health community and our public health community. Everything from our nurses who showed up every day, right into the ICU, right in the middle of a pandemic, and what that meant. You know, we were just cheering outside, yelling heroes, but it's much more than that. What you see in terms of pharma taking the lead, what they did in terms of getting that vaccine out safely, out quickly, and out effectively. I think it demonstrated our lead around the world, what that means. And I hope to God we've all learned how to work together in the next pandemic a lot more, so we don't have to suffer like we did a year and a half ago. And I think make sure that our healthcare professionals are right at the table in all the policy things we got to do going forward, because you're part of our future in a more significant way than ever.
Well, Governor, thank you for leaving us on such an optimistic note. I completely agree with you on the importance of rebuilding our healthcare infrastructure, on celebrating the science and public health that have gotten us to where we are, and in what you said throughout, which is this theme of how we're all in this together. And we've certainly learned that lesson during COVID-19. So on behalf of all of us, I wish to thank you for your leadership. Thank you very much also for joining us for this conversation today, to Governor Lamont.
Okay, be safe, everybody. Take care, Dr. Nguyen. Thanks.